Thank you very much. Ljiljana, it's a pleasure to be here with all of you, and I kindly greet you from Cluj. I'm here today for a short, support for this wonderful work that you are doing. And we discussed that it would be really nice to have a short introduction about IPOS. And because you also talked about ECHO, I can tell you that last week we just had the ECHO Summit, the European Cancer Summit. And actually we have a new report, which is called Free of Cancer. And it just, has 7 priorities. And the first priority is to take action on cancer distress. So I couldn't tell you how timely your webinar, your meeting is actually today. So from the International Psycho-Oncology Society, a warm welcome. And as you might know, the International Psycho-Oncology Society fosters international multidisciplinary communication about clinical, educational, and research issues that relate to psycho-oncology. I will try to speak slowly and I will try to read because I know that you have translation, which is an absolutely great idea. The International Psycho-Oncology Society was founded in 1984 by many, but the most important and most representative is Professor Jimmy Holland. And today we have members from more than 100 countries. So that's really a very important society. And we have somehow around 700 members from more than 100 countries. Our society, the International Psycho-Oncology Society, seeks to provide leadership and development of standards for education and research of the psychological, social, and spiritual factors in cancer care. So this is International Psycho-Oncology Society, and as you might know, cancer distress is actually a very unpleasant experience, that this is like a spectrum from normal feeling of sadness to disorders and to different kinds of burdens. And actually in this new report that was, published last week by the European Cancer Organization called Free from Cancer, Achieving Quality of Life for all cancer patients and survivors, as I told you, the top priority is to take action on cancer distress. And actually, I will be more than happy to share with you, Ljiljana, or all of the colleagues from Croatia that are together with us today. This is a report around 30 pages, and this point about taking action on cancer distress, actually, it's one of the most important. So I will make sure that you will have a copy of this report. And as you might know, the International Psycho-Oncology Society is also a member of the European Cancer Organization. And coming back to cancer distress, you have to know that this kind of experience that many of people affected by cancer are experiencing is actually a major factor of poor quality of life. And it has, unfortunately, detrimental effects not only on cancer patients and survivors as well, but also on their caregivers, their families, their partners and friends. So it's very important to understand that cancer distress, it's not just something like bad thing happening and, experienced by people affected by cancer and their most important, support networks. But actually, it's cancer distress, it's associated with delayed or maybe denied treatment. Also, it's associated with, a reluctance to disclose cancer status. And of course, high cancer distress, it's also associated with difficulties in asking for help. So in attending support groups, and also as a whole, it's also cancer distress is associated with lower survival. I mean, we have so many data on this, and I am, truly glad that Croatia and you are joining this network of research in cancer distress, because, cancer distress, it's a real burden, and sometimes even survivorship without, taking care of psychosocial needs. It's really a burden. But I have to tell you, we are speaking about, cancer distress screening and management, because there is also very strong evidence that psycho-oncology interventions are demonstrated to be effective in improving psychosocial outcomes in cancer patients. And that means that, we are not talking only about cancer distress screening, but we are also talking about cancer distress management. And I think that's an important message for you, because screening cancer distress, it's very important. Actually, in this report that I have been talking about, Free from Cancer, published by ECHO, we say, and we strongly recommend for all the European, countries, that early, systematic, and regularly updated psychosocial screening and monitoring in all phases of the cancer disease trajectory should be provided, including with digital means, because nowadays, because of the COVID situations, e-health and m-health are very, close to us. But that's not enough. Actually, today, we are generating, needs and communication about cancer distress in Croatia. And of course, it's very important to have this kind of comprehensive and stepped psychosocial assessment of cancer patients, taking into account all the physical, emotional, practical, family, and spiritual, needs and concerns. But it's also as well important to provide not just screening and monitoring of cancer distress, but management of cancer distress, which means you have to provide services. So today we need to talk and speak about both, because it's very important to have treatment for cancer distress. And it's very important that this can be, any kind of valid psychosocial support, such as individual or group psychotherapies, psychoeducation, cancer coaching and counseling, relaxation training, and also, very important, a very broad range of self-directed interventions made available to persons affected by cancer, which is of absolutely great relevance during this ongoing COVID-19 pandemic. So I would say that we have to listen to cancer patients, and we have to listen to professionals, and we have to speak with decision makers, because psycho-oncology needs are unfortunately regularly identified by cancer patients as an area of unmet care need. So we need to do more, and we need to have we have to build the resources to do more. So I think the key message for this evening, and I am sure we are going to discuss a little bit more about that after, the results are presented to us. The message today is to take action on cancer distress, which means cancer distress screening, as you did wonderfully in your research, but it also means monitoring and intervention in cancer distress. Well, it's a little bit difficult, Ljiljana, because I don't really have translation, but I followed the presentation. And first of all, let me tell you that the results are very interesting. And also, I have checked that you have done a multi-center research, if I understand correctly, and your statistical, analysis also, it's absolutely in order. And it's very important that, actually this instrument, which was developed by Professor Alex Mitchell from United Kingdom, it's actually a kind of updated version of the distress thermometer, the original distress thermometer. This one, it's called emotional or emotion thermometers, ET, and actually it's used for detection and monitoring of emotional distress and emotional disorders in clinical practice. You can use it, of course, with persons affected by cancer, but you can use it in your clinical practice with other chronic conditions. And actually, this instrument is so wide and widely known and used that you will find, different translations on the official webpage. So I am really thrilled that in Croatia you are ready to use this instrument. It's very important that when you are monitoring and screening for distress, our patients, have so many, complicated needs and issues. And it's very important to have an instrument which is actually short, rapid, visual, and also, it's not really burdening. So I think this is one of the best choices. And because we have used it also in our research, and we have, recommended in so many institutions for clinical use, I have to say that, also our data, as you have seen in your data, are actually confirming its validity. I have seen that you have compared it against the HUTs, and I think your results are really, in the line with the validity parameters. So let me tell you that this is really an important moment. This is called capacity building, because now you have an instrument which is about, symptoms of anxiety, depression, anger, need of help. So I think it's going to be useful, and I hope you will have the resources to promote and put it in action for cancer patients and survivors all around Croatia. And as I see your community, I am sure you will do. During our meeting today, actually, I've checked your website. Again, I didn't, have translation for everything, but it's so nice to see that actually you have, the ESMO survivorship guide translated and, put it on your website. So congratulations for all your work. And let me tell you to all of you that we are waiting and we are welcoming you in the International Psycho-Oncology family. And we are looking out to collaborate more in the future. And again, it's really, really a nice job. And I hope that in the next year or two, when we are going to have an update, we are going to have more experiences shared from clinical practice with the, instruments used for distress screening and monitoring.
Thank you.